February is American Heart Month. As part of the effort to educate women about heart disease, the American Heart Association is hosting the Detroit Go Red for Women Luncheon, featuring Laila Ali as the keynote speaker. Heart disease is the #1 killer of women, and nearly 50,000 African-American women die from the disease each year. Nearly 50% of black women ages 20 and older have heart disease, and only 50% of African-American women know the signs and symptoms of a heart attack. Here to tell us about how women can take charge of their health is Janice Cosby Bridges, who's the Chief Marketing Officer for Ascension Health Michigan, and Dr. Joan Crawford, a cardiologist at St. John Macomb-Oakland Hospital. Welcome to American Black Journal. Boy, those numbers, really, that's hard to believe. I mean, you're talking about millions and millions of people who suffer from this.
Yeah, and it's not just African Americans, but it's everyone across the country.
Yeah.
It's unfortunate because, you know, we feel that cancer is the #1 disease, but heart disease, you know, it's more than any other disease.
It's bigger than
cancer, all the cancers put together. So,
yeah.
And it's a myth, but it will kill you. I mean, it's prevalent in our community.
Right, and it is a silent killer of sorts in that you could be suffering from heart disease and not really know it.
Of course.
So tell me about the dinner.
Well, the lunch.
The lunch.
It's the lunch.
It is later in the day.
Right. That's okay. We'll be celebrating all day. Right. But it's a lunch, and it's going to be held this year at the Detroit Marriott Renaissance Center. And it starts at 9 a.m. and we have all kind of workshops and raffles and all kind of things going on. And the lunch is actually at noon on February the 6th.
And what do you expect that Laila Ali is going to tell the crowd?
Well, of course, you know, Laila, I mean, she's the daughter of my hero, Muhammad Ali.
Right.
I'm a Louisville girl. I'm from Louisville, Kentucky, so I'm really excited about it.
Right.
But she, you know, she's all about health and fitness and cooking, and of course, you know, she was a champion boxer.
Sure.
So I'm sure she'll have an empowerment message, and I think that's what Go Red for Women is really all about, is just owning it and taking responsibility for your numbers, your health, changing your lifestyle, and so we can really prevent heart disease and strokes.
Yeah. Dr. Crawford, is lifestyle the major sort of lever that you need to pull to try to change the statistics here, or are there other things?
Absolutely. And the good thing about this message is that 80% of the disease is preventable.
It is, okay.
And I think, you know, we can't change our parents. Beyond that, we need to own everything we do.
So some of it is genetic. In other words, if my mother or father suffer from heart disease, I'm obviously more susceptible to that same thing. But more of it, you think, is how I live.
It's absolutely how we live. And I think one of the messages that I always try to get across to my patients is know your numbers. So I think, like you said, empowerment. I think that the patients really need to understand what is their cholesterol, what is their blood pressure, what is their weight, where are they compared to where they should be, and then try to go throughout their work day and regular day, you know, bring food to work, do things where you control your environment. And women in particular, you know, we are the leaders of our home community, and I think we really need to step up and step out and continue to educate our family, our sons and daughters, and make sure that we get that message across to them so that they start earlier, you know, being more careful with salt, food, fat, processed food, things like this. Smoking, please quit smoking.
Yeah, please.
Right. In this community, I would imagine that there are other barriers that you face too to educating people about this. I mean, you talk about the deep poverty, particularly in the city. That makes this harder, right?
Yeah, it is harder, and I always advocate for everyone having a primary care physician, because I think it starts there, because you want this, it is preventable in most cases, and I think that if you have a primary care physician, they can kind of navigate you through the healthcare maze and make sure that you have the right test, and then if anything comes up, then of course they'll, you know, put you to, send you to someone like Dr. Joan Crawford here.
Right.
But I think that it is a challenge for us, especially in the African American community. But if everyone has access to the internet, and if you go to goredforwomen.org, you have the tools right there to really help to educate you about heart disease and stroke.
Right. I said in the intro that most people don't know what the symptoms of a heart attack are. Tell me about that.
The most amazing statistic for women is that 2/3 of women have no symptom at all before their heart attack.
Okay.
So they may present with sudden cardiac death, which is why you really need to get tested ahead of time and know. But having said that, in retrospect, most people do know that they were more tired, they were more fatigued. And I think some of the symptoms, every man knows center of the chest, left arm, jaw, those types of things. Half of women could have that, but women get discomfort more right in the epigastric region, between the shoulder blades in the back. It might be the right arm instead of the left arm, and many people just get tired and fatigued. So the tip I always say is, if you can't do this year or this season what you could do a few months ago, you probably need to get into your doctor and be your own advocate and ask for the EKG or ask for the stress test if you're suspicious that something's going on.
Right. How reluctant are doctors sometimes to pick up on these things?
I think because of this movement, and we call it a grassroots movement, I think because of shows like yours, that help us get the word out to the masses. I think I have more patients coming in now asking for tests, saying, I'm a woman, I know it's different. I think physicians years ago were pretty terrible. They did not even think that women really had heart disease. I think the numbers for the African American community seem to be about 10 to 15 years behind where we are the general community, because I don't know why, because we're not getting to the right people and getting the message out. So thank you so much, really, for allowing us to talk about this here.
But Steve, my mother died when I was 11 years old. She was 36. She died of a very rare cancer. So all of my life, I thought I was going to die of cancer, not realizing until I was educated about heart disease that
you're more
likely to die of heart disease, And so that's the thing. I'm always amazed when I speak to audiences, that light bulb just goes off with people. They're like, really? I mean, heart disease is really the #1 killer for women, and African American women is just off the roof, So I just think that we just really need to educate everyone.
And ladies need to know there isn't one woman who wouldn't call 911 for their husband within 5 minutes of his chest pain. The average length of time a woman takes to get to the emergency room is 12 hours.
Because they don't recognize
They think it's a gallbladder attack. They think it's indigestion. They think they have to pack their children's
It's a bad
lunch.
day.
It's
just a bad day.
They have something they have to do for the kids that
night.
Right. So they just can't seem to take the time for themselves.
What effect do you feel like the Affordable Care Act is having on this particular issue, both in terms of education and in terms of care?
Well, for me, hopefully, I think that more people, because they have care, they have a primary care physician.
More people have primary care
physicians, and they're not going to the ERs as often. I hope, presenting themselves. And sometimes, the ER is an ER. It's for emergent care, and it's not preventative care. And hopefully, with the Affordable Care Act, that more people are getting the care that they need. And they're, again, they're learning more about
just
their
that
body.
relationship with primary care
And it's not that
difference.
scary. We stress out about waiting and waiting and waiting, but if we get in early, hopefully it's more preventable.
The thing I'd like to add is I still think many people don't have insurance, and so I find myself educating people often. I'd like to say it here. If you don't have a doctor, even if you go to a doctor once a year and it takes the rest of that year at $10 a month to pay off that office visit, if you have hypertension or if you have a problem like that, the generic drugs at several different places are only $5 a month. And many people really think they can't afford
They can't afford it, sure.
What you can afford is to have a stroke or to have something like that. And strokes are one of the #1 killers as well. It's part of cardiovascular disease.
I was going to ask you about that. Is that what's the relationship between heart disease and stroke?
It's there, and the African American community is some of the #1 people that have higher amounts of high blood pressure and higher amounts of stroke and higher amounts of unfortunately, untreated people. You get high blood pressure and maybe you think you're not going to like the side effects of the drugs. And I think people just aren't educated to understand how important taking the medicine is and being compliant with the medication to avoid the long-term, down the road major problems.
Yeah, yeah. What are some of the things that, if you're looking forward, it seems like every year I do a show about this problem, and it's both on the education and on the care side. How do we get to the point where I don't have to do this show?
Well,
anymore?
we have a long way to go. I'm going to be here for years and years to come then.
Yeah.
You know what, it's getting better. I think more and more people are learning about heart disease, and fortunately I just learned that where stroke used to be the fourth highest disease, and now it's moved to fifth.
It's moving
so
down.
it's moving down. Yeah. So that's good, but I just think it's about education, and you know, people kind of opening up their minds to it, because again, it's amazing. People just don't get that it's the #1 killer.
Yeah.
And I think as we're so busy, so many people stop at a store and get prepackaged food, you know, the days of taking the time to have a family meal and not eating out. So it always goes back to the basics: salt restriction, exercise, staying active, and getting involved. And the statistics are amazing. People that get involved with the Go Red,
the numbers,
we actually find that the women, because you know you're out talking about this, so they try to trim down, lose weight, they're taking better care of themselves. So sometimes just getting active in the organization, not necessarily donating money, but time, and getting out there to help educate, it helps.
Well, great to have you guys here. You're both wearing your red, I see.
Yeah.
That's perfect.
Yeah.
All right.